Hi everyone, my name is Rob Harvey. I am the Associate Director of Operations for Specialist Services.
Hello everyone, I'm Adeze Bradshaw. I'm Consultant Psychiatrist and Clinical Director for Specialist Services.
So just to really quickly explain what's in the division. So for children and young people, we provide a number of services for both emotional wellbeing and mental health. And that's both in schools, in community settings, in hospitals, and in a child's usual place of residence. So we work both with children and with their families as well. We also provide mental health and physical health team for children and young people in the Lincolnshire Secure Service too. For adults, we provide the learning disability services, the specialist services for Lincolnshire. So the local authority provide the community nursing service and we provide the specialist services. And for adults who may be autistic, we also provide the autism diagnostic service too, so that's to find out whether or not someone does or does not have autism. For liaison services, we provide services into both GP surgeries and the acute hospitals, so whether that's Lincoln Hospital, Grantham Hospital or Boston Hospital, for people with learning disabilities and autism or autism. And we also provide a liaison service to our own mental health services in the other divisions for people with mental health problem who also have a learning disability and or autism as well. We've got some other specialist services, so these operate for the whole county, and they are our adult eating disorder service, for which we also have a day programme. We provide the dietetic service, so that's a dietitian if you need one, or anyone open to any of Lincolnshire Partnerships services. And we also provide the sexual assault referral centre. We have around 450 staff in the division. We work over all the age ranges from very young children to older adults as well. And we operate over the whole of the county of Lincolnshire, but also in North East Lincolnshire, where we run some services for children and young people in relation to their emotional health and wellbeing and mental health. Just to recap what happened in 2019-2020, so last year, in October time, we had to take the decision to temporarily close what is called Ash Villa. Ash Villa is a inpatient psychiatric hospital for children and young people. And when we closed that, we moved all of the staff from Ash Villa into the community to create the intensive home treatment service. And we did that with the aim of trying to avoid hospital admissions for children and young people around their mental health, or if they did need an admission, to make sure that it was for as short amount of time as possible. And that's part of the new care model for children and young people, which we'll talk about a bit later on. We also started to set up our Lincoln and Gainsborough mental health support team. So that's part of a national pilot, and that's specifically aimed at putting mental health staff into schools to make sure that we're supporting both teachers and education professionals, but also children and young people and their families, particularly in relation to anxiety and depression. Our children's services won a national award, so one of our services called Healthy Minds in Lincolnshire won the Mental Health Now Awards, and we've been shortlisted for other awards. We started the service I mentioned earlier, the dietetic service, and the Sexual Assault Referral Centre also achieved Lion Culture accreditation as well. This year, whilst there has been other stuff going on, a really significant thing we've had to deal with, as have all NHS organisations, has been COVID-19. So we have had to pause certain things. So one of the things that we paused was routine face-to-face appointments. As part of that, that meant that our autism diagnostic service for adults was closed in Lincolnshire, and autism diagnostics for children in North East Lincolnshire was also closed, as was our ADHD assessments as well up in North East Lincolnshire. Our eating disorder day hospital closed, and so did our crisis drop-in for children and young people. And we also have a number of meetings where we meet as staff face-to-face or as teams face-to-face, and we paused that as well. And as part of that, we asked our staff to stop coming into our offices as much, and that meant that we would only be using the office space for the people that desperately needed to be in the office and for emergency and urgent clinical work too. And also, as care homes and residential homes went into lockdown, we had to pause doing appointments in those kind of type of environments too, whether that was for children or adults with a learning disability or autism. To balance that, we still had to make sure that our services were still safe and accessible for the people of Lincolnshire. So we continue to see high risk service users and people who were deemed an emergency, and we continue to do that face to face. We developed a number of tools to make sure that we were prioritising the most vulnerable people and those identified as high risk. And the reason we developed the tools was to make sure that we were being as consistent as possible throughout the county, but also because we have a lot of different services in the division too, so we needed to make sure that they were adapted for that. We made sure that we continued to make regular contact with the most vulnerable patients that we have in the division, and the routine referrals then moved on to phone and video. So whilst I said we paused them earlier, we paused them face to face, but we continue to do stuff wherever we could by phone and video. We used our experts by experience and peer support workers to make sure that we developed a lot of self-help material, and that we did that in a way that was as easily accessible to anyone with a mental health problem, learning disability or autism. And we'll talk a bit more about that later on. And we also made sure that specifically in relation to COVID, that we trained our staff in some of the additional physical health skills that they might need. So for children and young people, to make sure that our services were still safe and accessible, in North East Lincolnshire, we work with our partners, so the local authority who provide social services, the voluntary and community sector organisations throughout North East Lincolnshire, and the provider of adult mental health services up there, to make sure that we had an all-age 24/7 crisis referral and advice line that was available to everyone who wanted to call. In Lincolnshire, we developed the Here For You line as well. So our Here For You line is a line that's available for professionals to call, get advice around children and young people's mental health and to make referrals. But we opened that to everyone to make sure that anyone could refer in. And we started to make sure that, because we have a number of different services within Lincolnshire for children and young people, we started to make sure that our referral processes were shared between those teams to make sure that we weren't bouncing people around between services. We have now started a 24/7 advice and crisis line, very similar to the one with North East Lincolnshire, and we're doing that with the support from our partners in the Adult Acute Division. And we have made sure that we co-located services wherever possible as well, to make sure that we have the required number of staff in a building at any one time. Also for children and young people, I mentioned earlier about the way in which we've developed some self-help resources. So we've developed training videos, we've developed a lot of advice for people who may be suffering around their kind of mental health, and we put that all onto the Lincolnshire Partnership Foundation Trust website. And on there, we previously, prior to COVID, we saw around 200 hits on that page a month. And for August, we averaged around 10,000. So we're starting to see a lot of demand for people being able to access self-help material. For the Lincolnshire Secure unit as well, we had a young person test COVID positive in there relatively early on. So we needed to make sure that we locked down that building as much as possible. It's already a locked unit, but we needed to make sure that we particularly made sure that COVID didn't get through the people that are staying there at the minute. And so we work very closely with our local authority colleagues to make sure that we reduce the psychological impact of anyone who needed to isolate. For all of our services, we made sure that we advertised those through social media in schools, because whilst we had to pause some very specific things, and whilst we changed routine work from face-to-face to digital and telephone, we were still open, and we wanted to make sure that anyone that needed our services knew how to access them. For people with learning disabilities, we put all of our key documents into easy read to make sure that everyone understood how to access the services if they needed to. But a lot of our services for people with a learning disability are accessed through carers, and we support a lot of carers too. So we made sure we continue to do that digitally, and that we develop booklets to support carers too. And around physical health, in case anyone needed to go into any of the acute hospitals in Lincolnshire. We made sure that people had a health passport, and that's to make sure that when people go into hospital, that the staff in that hospital understand the adjustments that that person might need and how they communicate. For autistic people, again, we made sure that health passports were in place as well. So some autistic people may find that communication is a particular issue for them. So again, trying to communicate what reasonable adjustments needed to be made was very important. But we also made sure that for the Autism Diagnostics Service, which paused, that we kept the contact details of everyone who had been referred in to make sure that for both GPs, they weren't having to re-refer, but also for the service user who had been referred in, that we would then just contact them as soon as the service could be reopened, rather than making people go through lots of different processes to come back in. And in relation to supporting our staff, we've done lots of risk assessments, either on specific groups of staff or for people in specific situations. And we've also asked people to not come into the offices as much, and as part of that, we've really tried to adapt how we work to make sure that people can work from home. We've had a real focus on supervision, so whether that's around making sure that people understand how the services are working in COVID world, and also that because we've changed the way in which we do some of the work, and that's been a long established way of working, that we want to make sure that our clinical supervision's been really up to scratch as well. So we've been doing that. And we've been really encouraging people to try and meet up as virtual teams. So even though a lot of our teams now haven't been in the same building for a number of months, we've been trying to make sure that people have a virtual cuppa or a virtual lunch or whatever it might be, just to make sure that they maintain that sense as part of a team. And I'm now going to hand over to Daisy to talk about what we're planning to do moving forward.
Thank you, Rob. Moving forward, I think we recognize that COVID was a rapidly changing situation for us, and now coming out of it, we're looking at to gather all the available data, and we'll do this by speaking to our service users, our carers, their families, and the staff to look at how they have experienced accessing our service during the COVID, and to also find out what worked well and what didn't, and what we can change depending on what we extract from those data we have gathered. In addition, as we open our buildings, our estate colleagues in estates, they've supported us in risk assessing the buildings. So they have looked at issues around how many people you can have in clinic rooms. They've looked at infection control and also clearly marking the buildings. Also, we are mindful that we might have a potential increases in referrals. So we have looked at how we manage this should we come to that point, particularly for children and young people. And how we have done this is to look at our caseloads and prioritize those in high risk and those in medium and mild, and put staffs around and increase our staff presence to be able to respond to those increased referrals. And this is more important as children go back to school. We're expecting the referrals to increase, and also as care homes and residential settings open up again to visitors. And we are using the range of online and range of leaflets and online trainings we have developed to support staff in those settings to be able to meet the expected demand presentations with people with mental health difficulties. Likewise, those with complex eating disorders, staff are trained and they're having a lot of online videos and online e-learnings for staff to use, as well as carers. And we have telephone helplines for carers and families to contact us and seek advice from. We continue to make sure that we offer the digital platforms we have trialed during the COVID period. and these include video conferencing facilities or telephone. And we know from speaking to our service users and their families, they have found this useful. So for us now is to find out a balance between patient safety as well as patient's preference of being seen and having their needs met. And as well, we'll support our professionals and service users. This is particularly important for people in our learning disability services, who mostly will communicate via their carers or their families or the professionals supporting them. And with the help and support of the guided self-help and the online training materials, we hope and we are confident that this will meet their needs. And again, we'll continue to adapt and change things as we gather evidence and feedbacks from people using those services. Our Eating Disorder Day Hospital has reopened, and this was supported by lots of preparations before reopening, and this included looking at how to meet the new government guidelines around infection control and limiting the spread of infection. They have done things around adapting the number of people they can have in the building, adapting how service users can attend, as well as how they manage the programs within the hospital. And early feedback suggests that both staff and the patients using these two services have found it useful. I think this is important given that during lockdown, most of these patients did not have access to the day hospital because it was paused. We will continue with the 24-hour, 7 days a week advice and guidance line that was recently started for children and young people. And this, again, we feel is quite important as we return to the new normal and children are resumed their daily life, both in school and at home and with their communities. Services like those ones serving the children and young people are now co-located in the same place. And this also goes a long way to make sure that we are maximizing the use of our buildings, as well as ensuring that colleagues can benefit from having each other to interact with, and also to have the catch-ups with. And also the integration of services we spoke about following the closure of Ash Villa and the re-emergence of the complex and crisis community service, which has been recently evaluated and found to be satisfactory to those using the services. Our autism diagnostic services, which we paused during the COVID, we are reopening it, and we are looking at different ways to collect the information we need for those services. For the diagnostic service, we're looking at doing things slightly like using the online platform to take the histories and to speak to professionals, and then looking at other ways to do the face-to-face. Some of the changes we have spoken about and discussed include use of clear view face masks to make it possible to have a face-to-face assessment. And I think it's important to reiterate again that for the ones referred during the COVID, we have their details and we'll be making contact with them to improve that ease of access to the services. The mental health support teams, which are there to support schools, professionals within schools, they continue to expand, and we're looking at going further afield. So in addition to the Lincoln and the Gainsborough, we're looking at expanding to the East Coast, which is the Louth Skegness area. And we know from the data we have gathered that this is what that students, professionals, and teachers, they have found it useful. And I think it's something we're hoping to take forward as we move into the new normal. New care models. this was conversation we started prior to COVID, and we paused during COVID, and we're coming back to it. It is a different way of meeting people's needs. And our children and young people service, the CAMS and the eating disorder team, they have the new care models coming. We have the CAMS service, they have evaluated the complex and crisis team and found that it's a very useful way of preventing children being admitted to hospitals, and also should you then need to be admitted and people are discharged quicker than usual back into the community. And also people are supported within their own family units, preventing that disintegration of family links. So in all, new care model, it is something that is innovative, it's a different way of working, is providing care nearer to people's home, and which we have found patients, families and carers prefer, and they have found it useful. Moving forward, we are going to do our very best to continue to meet our children and young people in our learning disability services, as well as eating disorder service users, to meet their needs. And we'll continue speaking to them and ensure we adapt our service to reflect what the information we gather back from them as we move into the new normal.